So a couple of days ago, a patient of mine gave me an article about Kelly Clarkson's weight loss journey and how she lost 41 pounds in 2023. And what do I think of it as a bariatric surgeon? So here is my take. I obviously see these articles a little bit differently. I try to read between the lines and really try to tell you how I think they actually did it. So to start off with, she's done a phenomenal job of losing about 40, 41 pounds so far. And obviously she was on the obese side. And right now she still has a BMI is 29, which still consider her to be overweight, but that doesn't matter because she's lost a significant amount of weight and so far has kept it off. Now, this whole thing started apparently with a scare where somebody told her that she was pre-diabetic. Let me tell you something. It doesn't matter if you're a celebrity, if you're rich. She could be one of my patients because all of my patients have a very, very similar story. Life catches up. They have two, three kids. And obviously, slowly over time, they put on the weight. And the first thing that they hear is you have prediabetes, you have high blood pressure, you have hyperlipidemia, your fats are all out of whack, and you need to do something about this if you are to live and enjoy your kids. So she could be just like any of my patients. So kudos to her for taking this. And really, usually you need something to trigger that, and something triggered that in her mind to go for this weight loss journey. So what did she do? Now, she does actually talk about a few things that she did. Number one, she says she went for a lot of walks, which is great. So exercise is extremely important. Number two is that she did change her diet to this plant, I think, paradox. I'm trying to look it up. It's plant paradox. And it's Dr. I believe it's Gundry. It's Dr. Stephen Gundry who has a book. It's called The Plant Paradox. Obviously, I do, again, get these. It's a low-carb, plant-based diet. It's extremely important to limit the number of calories that you're taking. Okay, so that's extremely, extremely important. And then after she lost 41 pounds, she says she's not on some medication. Does not state what medication these were, what were before, and what she's on afterwards. But if you're pre-diabetic, most people, and especially as she says, she listened to her doctor, will actually tell you, well, we have one thing that we can actually give you to help you both with your diabetes and with your weight loss. And those are semaglutide or one of the GLP-1 agonists. There are a bunch of them out there. The Zepbound is one, which is the Mounjaro. Those are the newer ones, and they were very effective. And so what I do find a little bit, I guess, disconcerting is even somebody like her will not come out and say that she used or used these to help her get to where she needs to be. Here is where I am a little bit kind of perturbed, to be honest with you. She has prediabetes and obviously overweight. And so she was offered a medication that will help with both. This medication can help her control the prediabetes, lose the weight. And once you lose the weight, you may be able to come off this medication because you no longer have prediabetes. But it seems that the prejudice against just even seeking help to lose weight is so strong that a lot of people, she felt probably that she was going to be attacked. And so she had to say, hey, listen, I did not lose any tablet or these, gummies to try and lose the weight. And let me tell you, there are no gummies that will help you to lose the weight, at least not now. There are really not many pills that you can take to help you lose the weight. So most of these anti-obesity medications are actually injectables. There are a few medically prescribed medication, which are tablets, but generally speaking, they will not give you the kind of weight loss that that Kelly Clarkson has been able to. So here's where I'm going to actually make a prediction of where this story is going to end. And of course, there are going to be some factors here that I do not know of, but I have seen this story over and over and over again, and I can see where it's actually going to go. Reading the whole article, seeing what's been done, here are a few things that she did. Number one, severe calorie restriction diet. So that works in the short run. Most likely she went on injectable anti-obesity medications. Again, nothing wrong with any of these. What I don't see is I don't see a long-term plan for diet that she can stick to. And remember, your diet you don't need to stick to your diet 100% of the time, but you need to be sticking to it 75 to 80% of the time. And then you can splurge every now and then to kind of guide to remember, because obesity is not just a simple physical problem, physiologic. It's actually also psychological, and it's also, plays with your head. So you have to satisfy both if you're going to have a long-term success plan. And I, again, don't see a lot of exercise. Basically, she's, walking in the city, and that's all she's doing. So unless she continues to take those anti-obesity meds, what will happen is she's going to gain this weight back. Because again, as always, I don't see a long-term strategy. The most important thing is to have a long-term strategy with multiple kind of shorter term goals where you basically will see whoever's taking care of you, dietitian, your weight loss provider, your, who is going to manage your obesity, not just the weight loss. Anybody can lose weight. It's how do you manage the obesity in the long run? So that's my prediction.